I'll let everyone in. Hey everyone, thanks for joining us. Just letting a few more people in from the waiting room and we can get started. All right, yeah, so very excited for our topic today. So I'll do a quick introduction of our speakers, Joey Rodriguez and Bernalyn Ruiz-Yu. Bernalyn is an attending psychologist and instructor at Boston Children's Hospital and Harvard Medical School. She completed her PhD at the University of Massachusetts, Boston, and her doctoral internship and T32 fellowship at the University of California, Los Angeles in adolescent serious mental illness. So as a clinician, Bernalyn has experience working with diverse patients of all ages with a particular interest in helping adolescents who are experiencing psychosis and those also identified as being at risk for psychosis. We also have Joey Rodriguez, who's a clinical research assistant and a school and work coach at the Response to Risk program here at Beth Israel Deaconess Medical Center. So Joey's involved in the clinical outreach, research, and training initiatives through this Response to Risk program, and provides school and work coaching through the INVEST study. Particularly as they're joining us today, Joey and Bernalyn are both co-founders of the Salud Advisory Board here in Massachusetts, which has the goal of assessing the needs and resources of Spanish-speaking clients, clinicians, and families in Massachusetts early psychosis programs. So that is what we've invited them here to talk about today. They've been doing a lot of work to really talk through what are the kind of unique needs of this population in Massachusetts and what resources are out there, what resources do we maybe need to develop. So very excited to kind of focus that conversation today. So Joey, I'll hand it off to you. Thank you guys for joining us.
Thank you so much for that wonderful introduction, Kelsey. I appreciate everyone being able to hop on today. I'm going to share my screen. Please wait one moment. Okay. Sorry about that. 1 second. Okay. Can everyone see my screen? Excellent.
Yes.
So again, thank you so much for having Dr. Ruiz, you and I on today. We'd like to talk a little bit about a wonderful opportunity. We've had the chance to organize and develop Salud and some of our early findings, a little bit of background, as well as some of our future plans. To get right into things, I just want to pronounce that Salud was a part of the Massachusetts Psychosis Prevention Program, which focused on improving the mental health and wellness of youth and young adults in Massachusetts who are at clinical high risk for psychosis and early psychosis spectrum. M3P's mission was centered around the early identification, prevention, and intervention for youth at this population. Importantly, Salud was an effort to enhance the goals of behavioral health, equity and accessibility, and timely care for young people at early psychosis, regardless of any intersectional, ethnic, gender, socioeconomic, sexual orientation, geographic location, or especially language barriers that might come in accessing care. So Salud is an effort to facilitate the goals of M3P, specifically pertaining to language. Salud specifically stands for the Spanish Advisory Board for Linguistic Development. It comprises Spanish-speaking medical directors, psychiatrists, social workers, peer specialists, and psychologists from Latine backgrounds, all of whom provide care in Spanish for youth experiencing psychosis. Our long-term aims are to connect Spanish-speaking providers in order to identify and address specific needs in this field in order to develop priority areas and establish best practices. So the ultimate goal is with platforming Spanish-speaking clinicians and ultimately families and individuals insights into how early psychosis services are developed. We anticipate to better grow and identify growth areas to inform service enhancement and service improvement opportunities. Before we get a little bit into the work, I wanted to give a little bit of context on Spanish speakers in Massachusetts. Big picture, according to the most recent 2022 Census Bureau ACS 5-year estimate, Spanish is the most common non-English language spoken in households in Massachusetts. I'd also like to say that there is a large unmet need for Latin youth. Additionally, a large unmet need for Latin youth seeking services. This is kind of we've seen here by the 2023 Massachusetts Health Insurance Survey that Hispanic residents were nearly twice as likely to report unmet behavioral health needs compared to other populations. And of the 9% of Massachusetts residents who reported unmet health needs for behavioral health care, Hispanic residents were disproportionately affected. So I bring up this data because I think it speaks to the values of not only M3P's goals, but Salud, which is growing a statewide workforce capable of delivering services that have been reported in the past 4 or 5 years to be a need. So a key part of this effort is consulting with healthcare professionals to gain more information on just getting a better scope of what is needed to be done to improve early identification and intervention services for early psychosis services. So that concludes my contextualization. Now I'm going to move on to some of what we did so far at Salud. The approach that we've had to get a better understanding of developing priority areas for this population in Massachusetts were twofold. I'll begin by describing a little bit about the 2 online surveys that we created, organized, and developed and disseminated. And I hope that Bernalyn will go a little bit into detail about the semi-structured interviews we used. This was a strategy to better understand what specific clinicians, what specific needs or priority areas have been reported from psychologists, LMHCs, peer workers, social workers, psychiatrists, and medical directors, all Spanish-speaking within the realm of providing early psychosis services in Spanish. So I'm now going to start with the online surveys. We collaborated with early psychosis experts and designed 2 surveys based off of how mental health services can be assessed. The framework they developed essentially breaks down service evaluation into 8 dimensions, umbrellas under 3 key areas as access, safety, and service continuity. This helped us identify the focus areas for creating both surveys in tandem with collaboration with EP experts. They were created at the same time and then disseminated at the same time anonymously. They were both created using Microsoft Forms. From these surveys, we distributed them to Spanish-speaking providers with previous work with youth experiencing psychosis, as well as we targeted key team leads to gain like a broader understanding of clinic-wide language capacity program needs for Spanish-speaking youth. After that, we compared similarities and differences between the gaps and needs, which we asked and prompted clinic leads and also Spanish-speaking providers in these early psychosis clinics. I will so Dr. Ruiz, you will go a little bit more into detail about the preliminary findings of the thematic analysis, but I did want to say that just kind of giving context for that. Additionally, for the focus group interviews, as a part of our strategy to better understand kind of the experiences and what needs are being met or what needs are being met and could be being met better by Spanish-speaking clinicians. We also conducted, as a strategy, focus group interviews facilitated by semi-structured interviews created with EP experts with an outreach of our regional network in Massachusetts. The skeleton of these focus group hours began with an introduction hour, giving Spanish-speaking clinicians preface to why we're here and what the goal is, continuing to 4 bi-weekly focus group hours, and then a recap hour summarizing what we thought that the conversation themes have been, and hoping that the focus group participants would help refine that or give feedback to this. Focus group sessions were also recorded and transcribed to review. So I am going to begin by describing a little bit about our initial findings from the 2 online surveys. I will begin by walking through 2 graphs. The first graph compares direct service access in English services that early psychosis services can provide with direct access to Spanish services in these same early psychosis programs. Before I begin to describe the graph, I think it's important to note that according to the data from the online surveys, every CHRP clinic has access to interpretive services, meaning that they can provide services in language other than English through interpreters. Except for neuropsychological assessments, every service or appointment can utilize interpreter services. So before I get into the findings, I just want to mention something important regarding interpretive services. I think it's great that all of these CHRP programs offer access to interpreter services, and I think it's definitely a step in improving access to care. However, I like to highlight findings from a recent scoping review of, well, I think while interpreters are essential for ensuring access to care, there are limitations associated with their use, particularly in the form of like communication challenges and impact on clinical outcomes. So interpreter services are certainly better than relying on like untrained or ad hoc interpreters. There's still growth areas where having direct access to Spanish-speaking staff would result in more effective and enhanced care. I just wanted to preface that before we get into here, because if we take a look, what we're looking at in this graph is direct access to Spanish-speaking services, meaning services provided by fluent clinicians in Spanish without needing interpreter services. So we're comparing equitable and quality direct access to services in English with that same access in Spanish. And as we see here, starting with diagnostic evaluation, care coordination, individual therapy, and family therapy, we see that programs are approaching direct access for Spanish-speaking clients. However, there are gaps in direct access for services in Spanish, like psychiatry, school and work coaching, neuropsychological assessments, and group therapy. So these areas are still opportunities for improvement to provide direct access to Spanish-speaking services in these CHRP programs. Next, we asked of these services, clinicians and program leads, what would you like to see improved or expanded to be available in Spanish? This graph is a visualization of their responses. I show this graph because I think it's important to highlight that there is overall both clinic director and clinician alignment with the need for an enhancement in Spanish-speaking services across the services that these clinics provide. Finally, I'd like to touch base about clinician and clinic director identified needs. So we previously asked what services you'd like to see improved or expanded. our final question for the surveys, we're prompting Spanish-speaking clinicians and clinic directors. What do you think would be the best areas to develop in order to enhance these services? I think one notable finding here is that there is alignment on more staff and materials from Spanish-speaking providers and clinic directors, community outreach. There is a notable difference between community outreach and funding between Spanish-speaking provider-reported needs and clinic director-reported needs. I think that there is still a lot to interpret here, but I did want to say how there was alignment on training, materials, and more staff. To kind of lead to the thematic analysis, I wanted to say at the end of the online survey, we asked what are some resources that might better support your clinic in providing comprehensive care for clients and families whose preferred language is in Spanish. I think things that stood out were opportunities to train Spanish speakers, Spanish fluent coworkers and investment in multilingual staff, a resource hub for Spanish-speaking families, as well as funding and cultural competency training for the staff. To bridge our, so speaking of focus groups and kind of these self-reported descriptions of how services could be enhanced, I'm going to hand off the second strategy we used to better understand priority areas to Dr. Ruiz Yu to speak more about the strategy we used to analyze the focus groups.
Thanks, Joey. Yeah, so as Joey was talking about, first we disseminated these 2 online surveys, kind of get a more quantitative understanding of what is out there and what is available in our programs in Massachusetts. And then we had these semi-structured interview-based focus groups to get more of the qualitative understanding of what providers, folks who are providing care to Spanish-speaking families and patients, what they're describing is going on and where their gaps are. So the focus group included psychologists, LMHDs, peers, like peer specialists, social workers, psychiatrists, and medical directors, all Spanish speaking. You can go to the next slide. And so in total, we had 11 participants in the focus groups. And these occurred, we had 4 of these every other week, virtually. So how we developed the interview. So the aim of the interview was to, we were thinking just to investigate to understand the quality of care available to Spanish-speaking clients, satisfaction and engagement, limitations and resources for clinicians, and clinician feedback on the services available. And this was developed by myself and Joey, and then we consulted with other experts in early psychosis. We used a thematic analysis approach. We really used a data-driven approach to develop the code book as a team, and allowing the data to speak for itself, to just get kind of a lay of the land and get an understanding from the people who are doing this work of like what is going on in our state. So we developed the code book. So that included myself, a psychologist, 1 clinic coordinator, and 2 research assistants. So Joey, and we had 2 wonderful research assistants, Melanie Maldonado and Olivia Tapia, who are on here today, who helped transcribe and code and develop the code book and recheck the code book and resynthesize. And so all that whole process of really refining our analysis. So yeah, as I just mentioned, the code book was developed through an iterative consensus approach. So the participants who participated in the focus groups, I mentioned kind of their roles previously, but identity-wise, they identified as Puerto Rican, Cuban, Chilean, Ecuadorian, Peruvian, Mexican, and one did not specify. And the overall themes that emerged from the focus groups included structural, and I'll go over these in details in the next slides, but structural challenges, insurance reimbursement model challenges, language diversity, cultural awareness, resources, tools, and materials, workforce development, and Spanish-speaking community outreach. So to go over the first theme, structural challenges. So here the focus group participants described that the present sort of behavioral healthcare system in our country really gets in the way of clinicians being able to provide the best possible care to Spanish-speaking clients and their families. And I think others would probably say this is true for any clients, not just Spanish-speaking clients, but just highlighting that there's even more involved to really provide the best care possible. So for example, they reported needing more time to serve Spanish-speaking clients. Usually, this can come in the form of like involving family members in the sessions and needing more time to establish rapport, which I'll go into in the next few slides. They described feeling overwhelmed by the lack of work support and not having time to seek training, really focused on this population. So we have this quote here from a psychiatrist participant who stated, he says, but you're right. So this takes a lot of effort, time, and money. There's so much more that can be done where we're talking about, especially in the Latinx community, people of color, there's just so much more that people don't know, even in the process of how to find a provider. What does an intake and the follow-up look like? What blank name redacted was talking about. So I think there's a lot of work to be done. There's a lot of great ideas here, but having those resources, which no individual hospital, no individual person would be able to do alone, would be really important. So really highlighting that there's a need for the structure of our behavioral health care system. Oh wait, it's not created in a way that really allows clinicians to do their best work. So related to that, insurance reimbursement challenges. So here we're trying to pull out that there were specific mentions of challenges and barriers faced by providers from like a billing standpoint. So from the current insurance reimbursement model of productivity and how we measure productivity of clinicians in our country, really getting in the way and resulting in staff not being able to not being compensated for the full scope of their work, especially if they're working with Spanish-speaking clients. So they describe challenges with funding, not getting paid for work needed to provide the best care. So like I mentioned, needing to do maybe a little bit extra outreach, needing to translate materials that don't exist, needing to go out and like search for the materials. So, or like being the only provider in the clinic who speaks Spanish, and then you're having to field, right, all of these questions and consultations, and you're not being compensated for this time. So we have this great quote from one of our participants who said, right, if our job is being measured by productivity, like how you know, oh, did you see X amount of clients this week? Okay, that system we know very well. It's not conducive to access, or it is not designed for access. So I think we need to build a community to rethink access. Language diversity. This one came up many times, and I think was one that we were not super surprised by, but the participants described a need for more representation, or at least more of an acknowledgement of the diversity of Spanish sort of dialects across regions and countries, or just that like people who come from different Spanish-speaking countries might use Spanish that's a little bit different. So, for example, my background is I'm Mexican. I certainly have clients who speak Spanish who are, for example, Dominican, and it takes us a little bit of extra effort sometimes to like understand each other. So here we have some quotes, and I have that in Spanish and then in English. The Spanish is the direct quote, and then the English is the translated quote. So I'll read it in English. They say here, I think that there is a tendency to think that Latino is the same as Mexican. And that is a big mistake. That is a big mistake. And I've had to deal with it from both points of view, not where it's promoted in the hospital or that there is a therapist who speaks Spanish. And someone Dominican comes and tells me, yes, but you don't speak my Spanish. And I say, he's absolutely right. I only speak one kind of Spanish. And I can make the effort to talk about trying to communicate in more neutral language, something in common, right? And that just feels awful because the health system encapsulates me and puts me as as an expert of absolute diversity. And I also want to add another quote that I couldn't find, but I'm remembering. One of the clinicians described this really this I think this instance, an example of a situation that really impacts treatment. They mentioned that in one of their sessions they had a client. I don't remember what their country of origin was or where their Spanish kind of came from, but they were there was a misunderstanding in the word. The client was saying, "I'm feeling really depressed. I need to use my alma." Um, but the clinician didn't understand if they were saying arma with an R or alma with an L. And these two are very different. Arma is weapon, alma is soul. So there was this situation where the clinician was kind of needing to navigate having, making sure that they really understood what the client was saying. As you can imagine, if you have a client who's really depressed and who's describing having to solve something with a weapon, that's going to take you in a very different direction than saying, I really need to solve this with my soul. And so just kind of highlighting the language diversity that exists in Spanish. Next slide. So related to this, and I'm sure it's probably not surprise to folks, but having cultural awareness is very important when working with Spanish-speaking clients or clients from Spanish-speaking backgrounds. So the clinicians talked about the need for providers to be aware of Latina cultural context in order to practice culturally responsive care. And again, like I said, this is not going to be a surprise, but so like being knowledgeable about the societal context, family dynamics, acknowledging of like cultural remedies, appreciation of intersectional identities. And so we have this great example here. So again, it's in Spanish, which is the original, and then in English, which is the translated version. So in English, it requires a lot of things and to establish trust. And I think that is where the part of, let's say, our conference here, so the meeting, it's like all of those values that we have, well, of like being very friendly over coffee. It doesn't translate quite well, but cafecito, it's kind of like a cultural thing. So, but anyways, but the concept being like having that social time of like sharing a coffee with someone. So then they go on to say, I mean, like all these types of conversations that we have to have before we start to say, okay, let's talk about this crisis. So that's something that I add in addition to what the other people say. Resources, tools, and materials. So the clinicians many times talked about the need for quality materials and resources in Spanish. This typo. But anyways, so they talked about the need for clinical assessments, handouts, therapy materials, and I just want to really emphasize quality because I'm sure there are probably other Spanish-speaking providers on the call who've maybe been searching for materials to work with clients. You really need to like read them before you use them. Not only because of the dialect differences, but maybe they're like outdated or like um, you know, the the quality just isn't quite as there. And so that was really something that stood out. So we have again here a quote in Spanish and then a quote in English and then translated in English. So in English, he says, and there is very little literature in the United States that is really adapted in Spanish. Okay? Because the translations that I have found they are very bad, very basic, and they really do not speak or do not educate or psychoeducate families completely. And I want to also add to this, there was an acknowledgement and a discussion in the group. It didn't come out as like a theme because it only came up once, but just it is important. There was a discussion around like we have opportunity, like we should be connecting with other Spanish speaking countries. Like we had a participant who came from Puerto Rico and was saying like, a lot of these things do exist in Puerto Rico, but like for some, there seems to be like I don't know, like there seems to be like an access gap for some reason, like we're not getting um, the sort of maybe more quality materials that are being developed in these Spanish speaking countries. So that was brought up, and I thought it was a really great point of we don't need to start from, nowhere or even like take these, you know, poorly translated materials, but there are places where communities and professionals who we could be collaborating with. Okay. Oh, it looks like it's for some reason the slide's a little bit cut off, but that's okay. I'll oh, almost still cut off, but okay, we'll see what happens. So workforce development. So and we're getting towards, I think this might be one of the last ones, but workforce development. So they talked about, of course, the need to recruit, train staff, and maintain Spanish speaking staff. Um, and I want to highlight is we're talking about Massachusetts. And so as Joey mentioned in the very beginning, in Massachusetts, there are a lot of Spanish speaking families. There are a lot of immigrants, and I would say that the population is growing. Um, so yeah, so there's this need where we really need more staff who can do this type of work. So we have the quotes here again in Spanish and then in English. So they say another big problem is what resources are there? What techniques are there? What treatments are available? Because since you understand it as well, like the client comes, right? I want to be treated for that, right? And then you say, as a clinician, well, it is, they can treat it for you, but there is no one who can treat it, or there are very few who can treat it. So highlighting this issue of there are things that we can see a client and say like, well, yes, like there is this thing that exists to treat this, but there aren't any client providers who speak Spanish who can do this for you. And so that's a real challenge. And then there was one sub quote that we thought was important to highlight. There was talk about like that it would be really valuable to have a clinical network for Spanish speaking, like network of Spanish speaking providers. And so they were talking. So this one quote, just kind of sums it up, saying, I think there's enough of us in the Boston or greater Boston area that potentially would be interested in something like this, but creating some sort of shared resource where you have people who have expertise in particular areas, where we can have these kinds of conversations, or patients in the community where you have medication specific questions or forms for providers, for other people in English saying that they exist in English. Why couldn't we have that in Spanish? Um, so that was something that also we talked about. I think Joey will touch on next steps. Go ahead. Great. And I think this is the last theme that came out, Spanish speaking community outreach. So of course, again, probably not a surprise, participants mentioned the importance of outreach tailored to Spanish speaking communities. This includes the need for collaboration and partnerships across programs to build trust and improve access to early psychosis care for Spanish speaking folks. So again, I think a lot of people are maybe not aware that the services exist or that they are available. So how do we communicate that and make that known to the community? So we have a quote here again from a peer specialist in Spanish and then English. And so they say, what I also see is that these community clinics have these services that are totally separate from the other clinics in the hospitals that do research, that do more academic things. And I think there's an opportunity to share those skills between those two communities, be able to incorporate more people who speak Spanish in our hospitals, but also put the resources in the community. Next slide. I
So,
think, yeah, Joey.
thanks, Dr. Ruiz. So just to kind of wrap up things here, um, uh, I just wanted to say that to give kind of like an over-encompassing of what we've been seeing so far, that is from the clinic side and from the like online survey side, not only do we see clinician and clinician, peer, LMHC, and so Spanish-speaking provider and clinic alignment on what are the discrepancies in enhancing care, what are the needs, and what are the next steps. But as Dr. Ruiz, you elaborated in this portion of the thematic analysis, we see on a more like specific lens, the specific resources and the specific day-to-day problems and unique challenges that the providers, Spanish-speaking providers in Massachusetts are going through. There are a few next steps in the future that Salud is currently in the process of developing. One of them is a resource hub, which right now is only a website. I just put it in the chat. I also think that there is a website. This website might be accessible through MapNet. Not sure if Kelsey might be able to send a link, but this link should work towards the Salud website, where it has all of the internal Salud team, our contact information, where we hope to start creating a network of resources that we can share. And also like future opportunities might include office consultation hours that we are able to offer through Spanish-speaking providers that are willing in the field of early psychosis to talk with clients and families, as well as other providers. Additionally, we are currently working on a workforce development initiative that is to train Spanish-speaking communities in the field of in the state of Massachusetts with mental health first aid training. The expectation here is to reach out to specific communities in Massachusetts and help them with mental health first aid, which is a training in how to have difficult conversations regarding crisis situations where people are demonstrating significant mental health needs. There will also be in this initiative the ability to have Spanish-speaking instructors trained as well, and these will be going to communities in Spanish. I did want to say just special thanks to the Massachusetts Psychosis Prevention Program, to the Psychosis Research Program, to Response to Risk Research at BIDMC, to the CHRP clinics, STAR, Reset, and Cedar in Massachusetts, all of the LUD Advisory Board members and people who participated in the thematic analysis and focus groups, as well as MapNet for having us on, for having this conversation and having us be able to chat more about this. I think that's everything that we have to share, but I think we'd also like to maybe open the floor to see if there's anything anyone else might want to chat about or ask any questions.
Yeah, thank you guys so much. And Michelle, I see you're on video and you posted a link to the mental health first aid website. So thank you for that. Is there anything else that you want to add, Michelle, about mental health first aid, kind of what it is, what we're kind of hoping to do with folks across the state?
Sure. And before I talk about mental health first aid, just want to thank Bernalyn and Joey for kind of leading this along with some of our trainees that I know are also kind of on as well, to kind of give a shout out to Melanie and Olivia and members of Salud that have been really part of this project. I just think it's tremendous. We've learned so much from you all already. The website is going to be an amazing resource if folks have ideas about things that should be on that website, want to send it in our direction, please post those in the chat, or I'm sure you can send us an email as well after the meeting. Really want to be creating a community across the state for serving Spanish-speaking families and young people as well, and clinicians. So mental health first aid is a sort of an evidence-based program that's been developed for non-clinical workforce. So it's training folks that are kind of in the community on how to help when somebody is experiencing mental health difficulties and help them, support them to care. We are lucky to have a grant that allows us to um, support the training of instructors. And in particular, we're interested in training instructors who can provide this mental health first aid training in Spanish. And so if anyone that's on this call is aware of somebody who speaks Spanish, who's in the community, it's not a really good fit for someone who's already a clinician, but someone who's wanting to become a clinician one day, it's a really good fit. And definitely let us know, let Joey and me know if you are interested in getting mental health first aid training or are sort of helping to sponsor training, or also if you are interested in getting trained or know someone who wants to become an instructor of mental health first aid, especially in Spanish.
I also want to just acknowledge and well, just acknowledge, right, that the sort of current state of our country and how this is presenting especially challenging times for folks who provide care for Spanish speaking patients and their families. Just to say that that is definitely something we've been thinking about, and I know that there are a lot of communities coming together to gather resources. And so if you need support in connecting with resources for your families or providers, please reach out to me. I have colleagues who we've been kind of putting stuff together, but I did want to just acknowledge that. And I'll put my email in the chat if you want to get in touch.
Yeah, I think it's particularly important. I mean, it feels just more and more relevant every day for this whole past month, but that these initiatives really have come from Spanish speaking members of the community, clinicians in this community who've been doing this work for a long time. Like those connections of like trust and kind of you know well-meaning and like community-based action just feels so important, and like the venue that this all should be happening through. So it can maybe as a plug to clinics in other states who I see some questions about, people kind of developing these same resources. That piece of trust is like so important, and I know something that you guys have talked a lot about, which is great. I'll just read out. We have one question in the chat from Craig Jones saying, our FEP program is new and we're working on expanding our outreach to local Spanish-speaking communities. Part of this, as you guys are saying, will include good quality reading and viewing materials in Spanish outside of our clinical handouts. So things like personal narratives of psychosis and recovery, family support guides, other general psychoeducation. So I know you guys are working on building out a directory of this, but is there anything, books, videos, etc., in Spanish that you would recommend for patients and families?
It's a great question. And I was just going to respond in the chat, but I think I saw your email in the PepNet listserv. I recognized the name and I was like, oh my gosh, this is so relevant.
Yeah, that was me.
Yeah. Cool. I was trying to think of like how to respond. I was like, okay, we've been working on gathering all of these materials. It's not on the website yet, but our aim is for the website, at least through MapNet, be kind of like a resource hub. So anything that's quality, we'd love to collaborate. I don't know if anything specific comes to mind. I did know that someone in the email chain mentioned La Clave. I know Dr. Steve Lopez at USC has done some really great work, making psychosis sort of literacy materials available for Spanish-speaking communities. So that's always a great resource to go to. But I don't know if well, anyways, I'll just end there. But yeah, I saw your email and our hub is in the work. And I'm also following the thread that you started.
Yeah, it's one of the things I was looking at is I don't have because I don't speak Spanish, I don't have a good way of evaluating what I'm seeing online when I look this up. I find some things that bad Google or YouTube translation looks okay, but I'm also looking at potentially like 5 or 6 hours worth of material that I'd have to look at. And so I didn't know, I was hoping that maybe other folks had been on the path before and again, we're identifying these. So I'm really glad to hear that your team is bringing this together.
Yeah.
Um,
I'm also connected with sorry, UCLA, obviously UCLA, being in LA has a lot of like Spanish speaking clients, and that's definitely a focus there. And there's a colleague of mine, Vanessa Calderon, who has been also leading some of the efforts at UCLA um who actually was Steve Lopez's student. Um, but so I'm gonna reach out to her, and I've been trying to like also pick her brain around just working together to get all this stuff together. I think kind of the point and like one of the main things we've been finding is like the stuff is out there. We need someone who can kind of like sit down and just kind of like dig through and like vet things as being like good and quality, and then having a place for it to exist. So yeah, that's our goal.
Yeah, I
And the
think
piece
that's a great.
especially, oh, sorry to interrupt, Joey. I was thinking
Oh,
about Craig, your ask, which was around like particularly like patient like client testimonials or like things that are coming from people with lived experience in Spanish. That is a huge area that I feel like more can be developed or at least pulled together. So I really appreciated that.
yeah, I was gonna echo the exact same sentiment that I think that personal narratives in Spanish is something that could be hugely beneficial for communities in Massachusetts and outside of Massachusetts. I think specifically speaking to if are there any recent, very, very general psychoeducation that's public facing uh, for folks for FEP programs and services. Um, Outside of, I think parts of MapNet are translated in Spanish. I know that there is a project that is happening, and there's this website called psychosis.org. I just put it in the chat right now. This was a public facing psychoeducation from students who worked under, I think, Paolo Lozano, who was a part of the Aspire Clinic FEP program at BIDMC. And this service I personally I thought that this was a effective it didn't have any personal narratives, but it did have your most general facing psychosis public psychoeducation that maybe a family member could scroll through to get a little bit of better understanding about the experiences that people that they're related to might be having. So I just wanted to share that, put that in the chat, but it's also the future hope of Salute to be able to consolidate and organize a repository where these links can be accessed on a keychain, so to speak.
Thank you very much. I very much appreciate the feedback and look forward to seeing where the project, how it develops.
One question I had, that Joey, you touched on this briefly in the beginning, but I wonder if you can say more on it, is this idea, a lot of our clinics have access to professional translators, which is excellent that that's kind of growing and becoming more easy for people to use, but that there are some limitations there. Is there stuff that people brought up either in the focus groups or in these kinds of conversations related to that, that you'd like to share?
Yeah, and Bernalyn, maybe that's a great, fantastic question, Kelsey. And Bernalyn, feel free to hop in to add anything else. But I think it was really, really an interesting find from the 2 online surveys that despite every program endorsing and reporting that that they are technically able to facilitate care via interpreter services, as along with providers being aware of this as well, there was still at the same time clear reporting that direct access to Spanish speaking services would be a facilitator for program enhancement. Across the board, there was clinic director clinician alignment on the prospect of getting better training and better resources, and that having direct access to Spanish speaking services would make every service better, would enhance their service capacity. So it's kind of an interesting situation where like both are true. I do think that they do have these services, but although I'm not a clinician, in the focus group interviews, there was conversation about how much responsibility can be put on a provider within the first treatment situation in circumstances of high suicidality or, you know, just like very complex caseloads. This is a sort of thing that I think like carries a unique burden on treatment when it's completely relied on interpretation services. And it was really cool to see that, not cool, I think it was really informative to see that be pronounced better in the focus groups. Not sure if you'd like to add anything, Bernalyn.
Yeah, no, I think, yeah, I totally agree. And then I was just gonna also add, I think I remember there being mention of like kind of trust being a piece that, I mean, of course, that's going to be part of like any sort of moment that there's like an interpreter involved, but they mentioned that kind of being a piece that maybe could potentially get in the way of the work, you know, the therapeutic work being as effective as it could be. And then, yeah, I think just reiterating the like, um, I'm sure all of us here, you know, who work with patients who experience psychosis, you know, really appreciate the sort of nuance that is needed when you're doing an assessment or trying to understand a patient's experience, maybe especially if you work with folks who are maybe like neurodivergent or maybe younger folks. And so being able to really maybe capture the like subtleties in language is, I think, especially important when you're working with patients who are experiencing psychosis.
Yeah, for sure. And maybe not something that an interpreter might necessarily pick up on. Yeah. Great. Yeah, other questions that folks have, either in chat or unmute yourself, either is fine.
I have a question for the audience, which is like,
Yeah.
so we presented kind of like what our folks are saying in terms of what it's like to provide care for Spanish speaking clients, or we would say like sort of clients who prefer services in Spanish. Um, was there anything that wasn't mentioned that maybe folks have experienced?
Mm. Yeah, for folks who are actually doing the work in clinics.
We really did that good. We covered everything.
You guys got it, yeah.
Right. Well, if any feedback comes around, you can email us or email me.
Yeah, maybe if it sounds like we're wrapping up, I can just put that out there. And I know you guys have said this before, like this is an ongoing project. These are ongoing you know, resources that are being developed, particularly with the mental health first aid. I'll say like if you have, you know, a chunk of your clients who are Spanish speaking or are connected to a community, like we have folks who are getting trained to do this and want to go into the community and do like mental health first aid training. So please, I know both of you guys put your emails in the chat. Most people have my email as well. Yeah, we want to be kind of continue to be in touch with this. This is really the start of something. So very glad to have all you guys here and just kind of hearing the kind of background to this, but more so looking forward to kind of continue work in the future. Yeah. Well, yeah, thank you so much, Joey, Bernalyn. It's been so helpful. Oh, great to see folks putting emails in the chat too. I really appreciate it. All right. Yeah, thanks everyone. Have a great long weekend if you're taking it.
Great, thank you. If you're putting your emails in the chat, does that mean you want more info on the mental health first aid? Is that what you're doing that for? Let us know.
Yeah,
Thank you.
great,
Okay,
yeah.
yes. Awesome. Thank you, Jonathan.
Great, thanks so much,
Great.
everyone.
Bye.